Ciment at the Chelsea Foot and Ankle Center in Manhattan. Today I wanted to talk to you about plantar fasciitis. Plantar fasciitis is one of the most common conditions affecting Americans today. A lot of times you will hear terms like heel spurs, heel pain, and there is a continuum between these kinds of issues and what is actually properly termed as plantar fasciitis. The plantar fascia is a ligament-like structure at the bottom of the foot. It starts at the actual base of the heel and it makes its way up to the forefoot, to the ball of the foot. So architecturally, it's a truss that holds up the arch of the foot. In many people, for a variety of different reasons, relating to things like weight gain, weight loss, a sudden change in your weight-bearing activities, there are a number of different reasons. People will start to develop pain in their heel. Typically, this pain is worse when you first step down in the morning, first step out of bed in the morning, or first step when you get out of a chair if you've been sitting for a while. The pain then begins to sort of ease up a little bit as you get moving with the subsequent steps, but it never fully goes away. Plantar fasciitis can come on out of nowhere and with apparently no precipitating factors. And there's a lot of different information out there on the internet about ways to take care of plantar fascia pain, but I have found that a combination therapy is the way to go. I recommend that patients take a combination approach to this, doing different things in order to actually address the heel pain and knock it out for good. One obvious thing that you can do is rest. And this seems like a very simple thing to do, but we're very active people, particularly here in New York, and we never seem to sit down. It's really important that if you have the option of doing something standing or sitting, think consciously about taking the option to sit down. Another thing that is really, really helpful is icing the area. People will often use a bag or a pack of ice or a bag full of ice cubes. I actually like people to do a combination of ice and rolling together. You can take a simple water bottle, fill it up with water or buy a pre-made water bottle, and then freeze it until it becomes a bottle of ice. All you need to do then is drop it on the floor and roll your arch underneath, with the bottle underneath your arch, going back and forth at your heel. You don't really need to be pushing down on it or anything like that. Just the weight of your leg resting comfortably, while you're seated with your foot on the bottle and rolling back and forth for about 15 to 20 minutes. It's really important that you don't over-ice the area. 15 to 20 minutes max is what you should be icing for any of your extremities. And then you want to give yourself 40 to 45 minutes afterwards to let everything sort of warm up. So I tell people, if you get home from work, why don't you ice your foot from 6 to 6:15 and then throw the bottle back in the freezer for 45 minutes, and then do it again from 7 to 7:15, throw it back in the freezer, 8 to 8:15, and so on and so forth. The ice rolling is a very helpful modality because it allows both ice and rolling together. The combined modality has an additive effect, and it really, really, really helps to calm down the inflamed plantar fascia. But ultimately, one of the most important things that you can do is stretch your Achilles tendon. Now, that sounds very strange to people because the Achilles tendon is not what's hurting them. The issue in most cases of heel pain is a tight, contracted calf muscle and or Achilles tendon. And this is something that happens to most adults as we get older. And if we tend to be a little bit more sedentary, or if we've suddenly become more active after being sedentary, the tendon, the muscle tendon complex can really, really go into a bit of a spasm, and it ends up pulling on the much less flexible plantar fascia at the bottom of the heel, and this can precipitate plantar fasciitis. So it's really important to do some Achilles stretching exercises, calf stretching exercises. There are many different ways to find this out on the internet, and certainly your physical therapist could help you and guide you through these kinds of exercises. The last recommendation that I make is that people take an anti-inflammatory. And no, Tylenol is not an anti-inflammatory medication. Something along the lines of Advil or Aleve, ibuprofen, Motrin, I find that they work very well. Of course, it's very important whenever taking any medication, even over-the-counter medication like Advil, ibuprofen, Aleve, you should consult with your doctor or with your podiatrist first to make sure that there's no interaction with any of the other medications that you're taking or any kind of allergies that you may have to a class of medications. But often, for many people, taking over-the-counter ibuprofen, Advil, Motrin, same ingredient, taking 3 of them, which is 600 milligrams in the morning, with your breakfast, with food, and then about 12 hours later, another 3, 600 milligrams, with your dinner, with food. That's all it takes to really give you a good, consistent anti-inflammatory dose, and after 5 to 7 days of that, you should start to notice that your pain is going away. Obviously, as with anything, if you're icing and you're stretching and you're resting and you're taking the Advil, and it's been more than a week to 10 days and you're really not feeling better, it's imperative that you get checked out by a podiatrist. We treat tons of plantar fasciitis pain here at Chelsea Foot and Ankle in Manhattan because we want to keep our New Yorkers walking. If you have plantar fasciitis or someone that you know, please, by all means, come into the office. We're happy to evaluate it and help you get you back on your feet, back to your normal self here at the Chelsea Foot and Ankle Center.